Hello, and welcome to the Suicide Prevention Psychology Rotation presentation. I am Dr. Stephanie Miller. I'm the team lead for our suicide prevention team here at James A. Haley Hospital in Tampa, Florida. I have been at the VA and in the suicide prevention team for 15 years now, since 2010. I was a psychologist on the team for many years and transitioned to team lead within the last 3 years. And I'll let my teammate, Dr. Smith, introduce herself.
Hi, I'm Dr. Samantha Smith, and I am a psychologist on the suicide prevention team. I've been with the James A. Haley VA since 2020 when I started as an intern, including having completed a rotation in suicide prevention psychology during that training year, followed by being hired as a outpatient psychologist for the Newport Richey Outpatient Clinic and then transitioning to the suicide prevention team in 2023. During my time as a staff member here at James A. Haley, I have been supervising psychology trainees across the practicum, intern, and postdoc levels since 2023.
All right, so this is how our presentation is organized today. We're going to give you a little bit of background and history of the suicide prevention programming in VA and spend most of our time talking about the actual rotation and what you can expect if you rotate with us here. Okay, so suicide prevention programming has been around for a while now. It started officially in 2007 when the Joshua Omvig Suicide Prevention Act passed. Joshua Omvig was a veteran who died by suicide in 2005, and his family set out to make sure that there was specialized suicide prevention programming in each VA facility. So at that time, the role of suicide prevention coordinator was mandated. So each VA facility had a suicide prevention coordinator that was a full-time position responsible for identifying, tracking, and monitoring high-risk veterans that were engaged in VA care. In addition to identifying and tracking high-risk veterans, SPC role was heavily influenced by education and outreach. So SPCs provided staff educations and community education related to suicide prevention in the veteran population and participated in community outreaches. So getting out into the community, setting up tables to talk to folks in the community about things like VA mental health programming and the Veterans Crisis Line. Research and program development has always been a core mission in suicide prevention, so making sure that we are developing programming that is helping to reduce risk in our veteran population. As you can imagine, there has been pretty significant expansion and evolution over time from the role of suicide prevention coordinator into suicide prevention programming and suicide prevention teams across the VA system. To give you an example of that kind of expansion, I'm going to talk about the expansion here within our program at James A. Haley. So we've gone from a suicide prevention team to an entire section called ARMOR that is responsible for helping veterans to reduce suicide risk really across the spectrum of care. So the suicide prevention team is what I've already described. So those core missions of identifying, tracking, and managing high-risk veterans, and supplemented by community outreach and education. We have in our ARMOR section a guardian team now that is responsible for acute crisis management and intervention. So they take care of the Veterans Crisis Line consult process. They run a crisis intervention email group and really take care of veterans at that most acute phase of risk. Last but not least, we have our CREW team, which stands for Crisis Recovery Engagement and Wellness. That is a team of clinicians that take care of veterans post-discharge from a hospitalization. to tell you a little bit more about our suicide prevention team here at the Tampa VA. We are a multidisciplinary team. We have psychiatry and psychology represented, of course, in addition to licensed mental health counselors, licensed clinical social workers, and a couple of psych nurses. Our team provides case management for high-risk veterans. So when a veteran is identified as high risk, they have a case manager assigned that will be engaged in their care for at least 90 days. The suicide prevention team also manages veterans crisis line referrals and has a robust clinical series, including group psychotherapies and individual clinics to treat high-risk veterans. Suicide prevention team is still very involved in education and outreach, both for staff and out in the community. And we also provide consultation to our clinicians across the system. So most of our consultations are with mental health teams and providers, but it's not uncommon for us to have outreach from different programs across the facility to ask about how to care for high-risk veterans. Suicide prevention team is also a big part of our suicide postvention team here at the facility. So our suicide postvention team provides resources and support for staff and family members who have been impacted by a veteran's death by suicide. And lastly, our suicide prevention team plays a big role in some of the national initiatives designed to reduce risk in veteran populations. So one good example of that is the Suicide Risk Identification Strategy, or Risk ID. This initiative has been around for 6 or 7 years now and really involves standardizing the way that we identify risk in our veteran population, really across the facility. So branching outside of mental health and going into the facility level in terms of identifying and then mitigating risk for our veterans.
So now I'm going to talk a bit more about how a suicide prevention psychology trainee will be able to take part in the responsibilities and tasks that were mentioned as a part of the suicide prevention team. To start, the intern rotation is supervised by myself, Dr. Samantha Smith, as the primary supervisor, and my main focus in supervision will be on clinical work, and by Dr. Stephanie Miller as the secondary supervisor, who will contribute to supervision in a combination of clinical and more administrative work. This rotation does take place across 2 facilities. When on the days that you would be working more closely with myself, you would be traveling to the Newport Richie outpatient clinic. That would be for at least 2 days a week. And on the remaining days of the week, for the days that you'd be working more closely with Dr. Miller, and for your didactics, you would be at the main hospital in Tampa. Just like all of the other rotations in this training program, the duration of this one is 3 months, and it is a training opportunity that is available to all of our interns, with a focus on helping to generalize the training experience. Given the wide variety of diagnoses and presentations that can experience risk factors for suicide, our clinical populations that trainees would be working with similarly see that diversity. So, high-risk veterans commonly experience diagnoses that range from disorders of mood, trauma, and personality to substance use disorders, and come with a variety of presenting problems ranging from emotion and behavior dysregulation, interpersonal difficulties, complex histories of trauma, and complex social and environmental problems. In your clinical work as a trainee in this rotation, you would be contributing to individual therapy, group therapy, and risk assessment for suicide risk. And that would include offering evidence-based protocols that are specific to addressing suicidality, like the Collaborative Assessment and Management of Suicide, or CAMS, and cognitive behavior therapy for suicide prevention, as well as EBPs that target common drivers of suicidality and presenting problems in folks at high risk for suicide, such as dialectical behavior therapy and skills training in affective and interpersonal regulation that can help folks manage things like emotion and behavior dysregulation. As well as direct client work, you would also be a part of our case consultations. As mentioned earlier, these are often with mental health staff here at our across all of our main and outpatient clinics, but also can include helping to work with staff across the hospital in managing, identifying, working with veterans that are at high risk for suicide. And in all of this clinical work, we hope that all of our trainees will walk away with an understanding of how to conceptualize cases using empirically supported suicide risk theories. In addition, this rotation offers some unique opportunities to participate in things like outreach and education. This can be as a part of both internal VA system as well as within the community. This rotation offers the chance to experience the Veterans Crisis Line consult process, learn more about how to identify when veterans are eligible for a high-risk flag protocol. We are also in a unique position to offer some opportunity to participate in quality improvement projects and some of those national initiatives that were previously mentioned, like the risk identification or risk ID strategy. And on top of this, we hope that all of our trainees get some exposure to all of the diversity and cultural competencies, ethics, supervision and supervision models, applications of relevant research and scientific knowledge, and professional development. Thank you for listening to our broad overview of what the suicide prevention psychology training rotation has to offer. If any additional questions come up, we welcome those inquiries. You can send, if you're in the VA system, messages via Teams to either myself or Dr. Stephanie Miller, or you can reach out to us via email and we will get back to you with those answers. Thank you again, and we hope to see some of you soon.
Thank you.